Recovering from an injury or managing a chronic condition can be a challenging process, but incorporating the right exercise routines can make all the difference. Gentle, intentional movement not only promotes physical healing but also improves overall well-being. In this video, we will dive into comprehensive exercise routines designed for recovery, emphasizing simple yet effective techniques that are accessible to people at all levels of fitness. Whether you're dealing with a sports injury, recovering from surgery, or managing a condition like arthritis or fibromyalgia, this guide is here to help you heal through movement. Understanding recovery through exercise. Physical recovery is a gradual process that relies on a combination of rest, nutrition, and appropriate exercise. Gentle movements are especially beneficial because they increase circulation, reduce stiffness, and help restore strength without putting undue stress on the body. However, before beginning any exercise program, it's crucial to consult with a healthcare professional or physical therapist to ensure that the exercises are safe and suitable for your condition. The exercises in this routine are divided into 3 categories: stretching and flexibility exercises, to maintain and improve joint mobility; strength-building movements, to rebuild muscle strength and stabilize injured areas; low-impact cardio exercises, to improve overall circulation and stamina. Let's explore each category in detail. 1. Stretching and flexibility exercises. Stretching is essential for recovery, especially if you've been immobilized for a period of time. It helps reduce muscle tightness, improve range of motion, and prevent future injuries. The following stretches are gentle enough for recovery but effective in promoting flexibility. A. Seated hamstring stretch. Sit on a sturdy chair with one leg extended straight in front of you and your heel resting on the floor. Keep your back straight and lean forward slightly until you feel a stretch in the back of your thigh. Hold for 15 to 30 seconds and switch legs. B. Shoulder roll. Sit or stand with your arms relaxed at your sides. Gently roll your shoulders forward in a circular motion for 10 repetitions. Reverse the direction and roll backward for another 10 repetitions. C. Cat-cow stretch. Start on your hands and knees in a tabletop position. Inhale as you arch your back, lifting your head and tailbone toward the ceiling, cow pose. Exhale as you round your spine, tucking your chin and pelvis, cat pose. Repeat for 8 to 10 cycles. D. Ankle circles. Sit or lie down with your leg extended. Slowly rotate your ankle in a circular motion, completing 10 circles in one direction. Switch directions and repeat. 2. Strength-building movements. Strengthening exercises are crucial for rebuilding muscle mass and stabilizing joints. Focus on controlled, low-resistance movements to avoid overloading your recovering body. A. Wall push-ups. Stand a few feet away from a wall, placing your palms flat on it at shoulder height. Slowly bend your elbows and lean toward the wall, keeping your body straight. Push back to the starting position. Perform 8 to 12 repetitions. B. Seated leg lift. Sit on a chair with your feet flat on the ground. Straighten one leg out in front of you and hold it for 3 to 5 seconds. Lower it back down slowly and repeat with the other leg. Do 10 to 15 repetitions per leg. C. Resistance band arm curls. Hold a light resistance band with both hands, standing or sitting upright. Step on the band with one foot to anchor it. Slowly curl your hands toward your shoulders, keeping your elbows close to your body. Lower back down and repeat for 10 to 12 repetitions. D. Glute bridges. Lie on your back with your knees bent and feet flat on the floor. Press through your heels to lift your hips off the ground, squeezing your glutes at the top. Lower back down slowly. Perform 8 to 12 repetitions. 3. Low-impact cardio exercises. Cardiovascular exercises can help increase blood flow, boost energy levels, and enhance overall recovery. Low-impact options are ideal for individuals dealing with injuries or chronic conditions. A. Walking. Start with short walks of 5 to 10 minutes, gradually increasing the duration as your strength improves. Maintain a steady pace and focus on proper posture. B. Water aerobics or swimming use the buoyancy of water to reduce stress on your joints. Practice simple movements like walking in the pool, leg lifts, or gentle swimming strokes. C. Stationary cycling. Use a stationary bike with minimal resistance. Pedal at a comfortable pace for 5 to 15 minutes, gradually increasing as tolerated. D. Chair marching. Sit on a chair with your feet flat on the floor. Lift one knee toward your chest, then lower it back down. Alternate legs, mimicking a marching motion. Continue for 1 to 2 minutes. Breathing techniques for recovery. Incorporating deep breathing exercises into your routine can enhance oxygen flow to your muscles and promote relaxation. Try this simple technique. Sit or lie down in a comfortable position. Inhale deeply through your nose, filling your lungs completely. Hold the breath for 2 to 3 seconds. Exhale slowly through your mouth. Repeat for 5 to 10 minutes. Tips for success. Start slow. Recovery takes time. Begin with shorter sessions and gradually increase intensity and duration. Listen to your body. If an exercise causes pain, stop immediately and consult a professional. Consistency is key. Perform exercises regularly, even if it's just a few minutes a day. Stay hydrated. Proper hydration supports muscle function and recovery. Combine with other therapies. Pair exercises with massage, physical therapy, or heat-cold therapy as recommended. Common mistakes to avoid: overdoing it. Doing too much too soon can hinder recovery. Stick to gentle movements. Skipping warm-ups. Always start with light stretches to prepare your body. Ignoring posture. Maintain good form to avoid strain or injury. Additional exercises for specific conditions. Different injuries and chronic conditions require tailored approaches to exercise. Below are some condition-specific recommendations to further enhance your recovery process. Recovery from lower back pain. Lower back pain is a common issue, but targeted exercises can help alleviate discomfort and strengthen the supporting muscles. Pelvic tilts. Lie on your back with your knees bent and feet flat on the floor. Tighten your abdominal muscles and tilt your pelvis upward, flattening your lower back against the floor. Hold for 5 seconds, then release. Repeat 10 to 15 times. Bird dog exercise. Start on your hands and knees in a tabletop position. Extend one arm and the opposite leg simultaneously, keeping your back straight. Hold for a few seconds, then return to the starting position. Alternate sides for 8 to 10 repetitions. Child's pose. Kneel on the floor and sit back on your heels. Stretch your arms forward and lower your torso toward the ground. Hold for 20 to 30 seconds while breathing deeply. Recovery from knee injuries. Knee injuries require exercises that strengthen the surrounding muscles without stressing the joint. Quad sets. Sit with your legs extended. Tighten the muscles above your knee, pressing the back of your knee into the floor. Hold for 5 seconds, then release. Perform 10 to 15 repetitions. Straight leg raises. Lie on your back with one leg bent and the other straight. Lift the straight leg to the height of the bent knee, keeping it straight. Lower slowly and repeat for 10 to 15 repetitions on each leg. Step-ups. Use a sturdy step or low platform. Step up with one foot, followed by the other, then step back down. Perform 8 to 12 repetitions per leg. Arthritis-friendly exercises. Arthritis can cause joint stiffness and discomfort, but gentle movement helps maintain mobility and reduce inflammation. Hand squeezes. Hold a soft stress ball or rolled towel. Squeeze gently and hold for a few seconds before releasing. Repeat 10 to 15 times per hand. Heel slides. Lie on your back with your legs extended. Slide one heel toward your buttocks, keeping the foot on the floor. Extend the leg back out and repeat for 8 to 10 repetitions per leg. Seated side bend. Sit on a chair with your feet flat on the floor. Place one hand on your thigh and the other arm overhead. Lean gently to the side, feeling a stretch along your torso. Hold for 10 to 15 seconds and switch sides. Post-surgery recovery. Post-surgery recovery requires careful progression to rebuild strength and flexibility without risking complications. Always follow your surgeon or therapist's guidelines. Breathing exercises. Lie on your back or sit upright. Place your hands on your abdomen and take slow, deep breaths, expanding your belly as you inhale. Exhale completely. Repeat for 5 to 10 minutes. Assisted range of motion, AROM. Use a towel or strap to gently assist in moving a recovering joint, e.g., shoulder or knee, through its range of motion. Perform slow, controlled movements as recommended by your therapist. Isometric exercises focus on contracting specific muscles without moving the joint. For example, tighten your quadriceps or glutes and hold for 5 seconds, then release. Creating a recovery routine. Consistency and structure are critical for recovery. Here's a suggested weekly plan for integrating these exercises. Weekly recovery plan. Day 1. Focus on stretching and flexibility, e.g., hamstring stretches, cat-cow, shoulder rolls. Day 2. Add light strength building exercises, e.g., wall push-ups, seated leg lifts. Day 3. Incorporate low-impact cardio, e.g., walking or chair marching. Day 4. Rest or practice gentle yoga. Day 5. Combine stretching and strength exercises. Day 6. Low-impact cardio with added intensity, e.g., swimming or cycling. Day 7. Rest or perform deep breathing and meditation exercises. The emotional side of recovery. Physical recovery isn't just about rebuilding the body, it's also about healing the mind. Chronic conditions and injuries can take a toll on your mental health. Exercise can alleviate stress, improve mood, and build a sense of accomplishment. Practice mindfulness. Focus on the present moment during your exercises, paying attention to how your body feels. Celebrate small wins. Acknowledge progress, no matter how small. Stay positive. Recovery can be slow, but every step forward is a victory. Healing through movement is a journey that requires patience, dedication, and self-compassion. These exercises are not just about regaining physical strength but also about reclaiming your sense of independence and well-being. Remember to modify exercises to suit your individual needs. Rest when necessary to avoid overexertion. Stay consistent for long-term results. If you're recovering from an injury or managing a chronic condition, share your story in the comments below. We'd love to hear how movement has impacted your journey. Be sure to like, share, and subscribe for more valuable content on physical and emotional wellness. Thank you for watching, and remember, healing is a process, not a race. Keep moving forward, one step at a time.